Welcome once again to our medical column, Ask the Doctor. I'm Dr. Wale Okediran, a general practitioner, a family physician of 45 years experience. As before, we're going to go through some questions sent to me by my patients. The first question has to do with the eyes. He said, I want to know if it is true that exercises for the eye can help improve the vision. And my answer is this. There is no science to support the claim that eye exercises can improve people's vision. It's possible that for centuries, people have promoted eye exercises as natural. But unfortunately, there is no credible scientific evidence to show that doing exercises for your eye can improve your vision. If you have any common eye condition, whether nearsightedness or farsightedness or problem seeing in the dark, eye exercises will not help you. What you need to do is to see a doctor who will look at you and then probably refer you to an eye specialist who will help you. Also, if you have issues like dry eyes, eye strain, blood vision or headache, or eye discharge, or redness in the eyes, all these ones will need the doctor's attention because it's not likely that eye exercises will help. Then the next question has to do with depression. He said, I have a relative who has been suffering from depression for the past few weeks. Can you let me know how to manage this condition? And my answer is that depression is a complex condition, and evidence from medical science show that both medication and psychotherapy can help to improve situation. Because of this, several techniques have been used to help those who are depressed. Some of them are problem-solving therapies, particularly where you will have to find out from the person after a detailed history taking to know what are the things that likely led to the depression. And this is why depression is something that needs to be handled by an expert. You will need to see either a psychologist or a medical doctor or a nurse that is trained in psychology who can listen to the person who has been confirmed to be depressed. Sometimes medication can help. There are so many medications in the pharmacy that can help, but it's nice to know which one suits the person by talking to the person. Also, meditation has been confirmed to help. When people meditate, either in the religious way or other ways, it can also help them. Then, when people also find a way to relax, can learn to there are some relaxation exercises, deep breathing exercises that can help you to relax your muscle, and so many other ways. And this also needs to be done by experts. So my answer is, please see a doctor if you suspect depression in your brother or sister, so that they can listen to the person and confirm what is causing it and then treat accordingly. Then this next question is about fruits. He said there's a controversy on the best time to eat fruits. Why some people you see that you must eat fruit before a meal, others think that the best time to eat fruit is after meals. Kindly advise. And my answer is that there is no definitive best time to eat fruits. Health experts agree that fruits can and should be incorporated into your diet at any time of the day. Neither your body or what you eat doesn't really doesn't really have to affect what kind of food you take, unless you are allergic to some foods. Then you can leave them alone. But if not, you can take them at any time. You can take fruits either as a morning snack or as a midday meal or after dinner in the evening. Fruits are very nutritious and have a lot of minerals. And again, what matters most is the variety of fruits in your body, because so that every fruit has its own support to the body. So you need to have variety of fruits. That is, you mix mango with banana, pineapple, pawpaw, and all these things, so that they can all combine to work very well. But as to time, it is not important that they must be eaten at a specific time. The next question is about migraine. He said, my 30-year-old sister has been complaining of severe headache for the past few weeks without any improvement. I recently read somewhere that this could be migraine. Please, what is migraine and how does it differ from headache? And my answer is that when you have headache that is very intense, that is very deep, and usually accompanied by a feeling of nausea, that is, that you want to vomit, or you cannot stand light or sound, then you can think of maybe you're having migraine. And usually migraine headaches are sometimes preceded by warning symptoms. Something will trigger them off. It could be a certain kind of food, a certain kind of drink, or it could be somebody who, after doing some stressful job, maybe he has done a lot of house job, or he has gone to the farm, or he has gone for exercises, then he will start feeling this headache. It could be migraine. Then also, usually the headaches are on one side of the body, unlike the normal headache that can occur all over the head. Usually migraine is limited to one side of the body, and it can be very severe, and can cause dizziness, and sometimes it can also make the person have difficulty in having sights. And like I said, you can feel like you want to throw up, or even people, they can even lead to vomiting. So this kind of thing will show that this one is migraine, not ordinary headache. And there are so many medications in the pharmacy that you can use to treat migraine. But before using medication, there are some things you need to do. For example, you can manage your stress. You sleep. Make sure you sleep well. Make sure you don't worry too much, and try and make sure that you eat a balanced diet. All these ones will help you. Then the next question is saying that I have migraine. My fear is whether I can travel by air, because people say that when you go by air and you have migraine and you go by air, the migraine can get worse. Can you please advise me? And my answer is this. I said, sometimes it's true that even without migraine, you can have headache when you are traveling by air, but it's usually very brief. When you are taking off or when you are landing, this is due to cabin pressure changes. It can come up suddenly and can last for a few minutes. But when you have migraine during a flight or before a flight, this one can be another problem. And the best way to avoid a migraine attack during your flight is to take your tablets before you travel. Make sure that when you want to travel, you have taken some of your medications. And again, when you are getting ready for air travel, try and relax. Don't be late. Take your time so that you don't have to rush. Because when you are rushing to travel, it can also aggravate your tension. And also, try and make sure that you sleep well before you travel. Get enough sleep before you travel, and make sure that you are you're taking enough fluid, because dehydration can also trigger migraine or headache when you are traveling. So you need to drink plenty of water before you travel, and even when you are in flight, you can make sure you have regular water intake, and then avoid taking alcohol or excessive amount of caffeine, because this one can also trigger your migraine. Migraine can be triggered off by excessive intake of alcohol or caffeine, that is from coffee. And lastly, it is important for you to make sure that you you are sitting where there is enough fluid and air in the cabin, so that you will not be too uncomfortable. If you are sitting in the cabin and you are feeling hot, you can alert the steward, air steward, so that they can put the overhead fan can be put on for you. Then the next question is from a 70-year-old man. He said, I want to know how much sleep I will need on a daily basis. How much for a 70-year-old man, how much sleep I need? And my answer is that medical experts have confirmed that adults 65 years old and older will need about 7 to 8 hours of sleep every day, ideally at night, at once. So that's what they are saying. 65 years and above, 7 to 8 hours of sleep. Then the next question is eating late at night. So because of the nature of my work, I tend to eat late at night, and I'm informed that it is not good for my health. Please, what is the best time for me to eat at night? And my answer is that although experts are not agreed on a time limit, what experts agree is that it is good for you to have in your last meal about 4 hours before your bedtime. And if you cannot do 4 hours, do 2 hours. Because people who eat meals well ahead of bedtime have enough time to properly digest their food. Taking time between eating and lying down also reduces the risk of having gastric ulcer symptoms or gastric reflux, heartburn. So leave a gap of about 4 hours before you sleep at night for your last meal. And the last question is about the teeth. He said, I've been finding it difficult to effectively chew my food due to some pain in my teeth. Can you let me know what to do? Well, this one is a simple answer. Anytime you have any problem with your teeth, see a dentist. That is the best thing, because they are the experts about teeth. People try to use all kind of home remedy. Some people put alcohol on their teeth. Some people put onions or all those things. It's always good for a dentist to take a look at your teeth, because it could be due to either a gum disease, there could be a hole in your teeth, there could be some inflammation of your gum, and so all these things need to be checked by a dentist who will now advise you before it gets worse. But if you are having pain in your teeth and you don't have access to a dentist on time, it's better to start eating soft foods. Make sure you eat only soft food. Don't bite, don't crack bones, and make sure you wash your mouth after every meal with some salt and water, warm water and salt. So that way your teeth will be kept healthy until you can see a dentist. On this note, we're calling it a day today. As I said before, I'm Dr. Wale Okedino, a 45-year family health practitioner, and next time we're going to go through more questions. Thank you for listening.